considered a senior at the age of 7 in most breeds. Some breeds the really large breed dogs tend to not have as great a lifespan as the smaller dogs, and so they might be considered a senior citizen at the age of 4 or 5. So it very much depends on breed. Well, the old saying was that 7 years per year to a dog, and I think that's probably pretty accurate, give or take. And it really does depend on breed, and it depends on just general health of each individual patient. Most important thing is to make sure that your senior is comfortable. One of the things that happens as we age, just as in patient or pets, they can start getting arthritis, having pain from back aches, old injuries, knee problems. So it's important to make sure that they're comfortable and happy, especially as they advance in age and become sick. It's just important to make sure that nutritionally they're getting enough protein and fat without overdoing it in case they might have a kidney or liver problem. As their eyes age, there may be some vision loss. A lot of times it's just a cloudiness of the eyes that's pretty easy to notice in some dogs, kind of a bluish haze. It's just like looking through the fog when we're driving, so it doesn't necessarily mean they can't see, but then sometimes that blue haze can turn out to be cataracts, which can be related to diabetes or just a natural aging change. So it's important to pay attention to that. Hearing loss, for sure. Having more trouble getting up and down the stairs, jumping up on furniture, running, doing all the fun things that they used to do when they were young and live. One really important thing to consider as our pets age is that their environment is safe. They may not be able to see as well as they used to. They may not be able to jump or walk as well as they used to. Falling downstairs is a real danger to senior pets, just like in people. Breaking hips, it's a real thing in pets too. So keeping them safe, making sure their environment, that they have places to walk that are that they have good traction with rugs or yoga mats is really important. Anything you can do to block off stairs, just to keep the environment as safe as possible. Well, you can actually do little things at home. You can take little walks around the house. You can go outside.
Dog need.
It's important to do at least one exam a year, but I really encourage people to come in twice a year, every 6 months. Since aging does happen faster in dogs, a lot can happen in 6 months in their little bodies. So we like to make sure that we're checking blood work, doing a good physical exam, checking teeth, all those things that can go wrong, we want to try to catch early if we can. Dysfunction is something that happens, it's similar probably to dementia in people. Dogs and cats can start to show signs of disorientation, of not sleeping well at night. Maybe they always slept really well, but now they're pacing or roaming at night. They can also have problems with knowing where things are in the house or falling down. Quality of life is really a tough one at the end of life. Only you know your pet, and as well, no one knows your pet as well as you do. And thinking about 3 or 4 things that are really special to your dog. Does your dog love to run and jump? Does your dog love to eat? Does your dog greet you every time you come in the door? And as a family, it's nice to sit down and think that when JoJo can't do those really special things anymore, then is that the time to make a decision to end any suffering that could be happening.
So,
euthanasia actually means good death, and it means euthanasia is a way of ending life in a very humane way. We first give a sedative so that your pet feels no pain through the process, and we then give an injection that ends life. It's a very peaceful process, and it's a sad time. We're here to help people through every stage.